Many, they believe it's one of the biggest health challenges now around the world. When many people think about global health, they still think primarily of infectious diseases such as HIV/AIDS, malaria, and tuberculosis. And for good reasons. They continue to be a significant problem and challenge in many remote places around the world. But we know that chronic diseases or non-communicable diseases, NCDs, cause more than 60% of deaths around the world, of which 80% are in the developing world. And that's part of the reason that we're all here today. Now, as a global health reporter, I have seen a lot of this firsthand. Significant rates of heart disease in Peru, diabetes in India, cancer in Southeast Asia. Exactly how to deal with these problems, exactly what the solutions will be as part of what we're going to be discussing today. China alone is going to lose around $600 billion over the next 10 years in foregone national income due to heart disease, diabetes, and stroke, again, over the next 10 years. And of course, all of these numbers that we hear about and that will be discussed today say nothing of the personal hardship that people suffer, disability, inability to be productive, members of their families or society, or the suffering and pain that is often associated with these chronic diseases. As things stand now, roughly about 3% of developmental assistance goes toward chronic disease specifically, about 3%, despite a lot of the numbers that you just heard.
35 million people die every year. The problem is grave and growing. Already heart disease, stroke, and diabetes are estimated to cost low and middle income countries as much as 5% of GDP. By 2030, chronic disease-related death in Africa, the Middle East, the Southeast Asia will grow by more than 50%. Globally, diabetes death will increase by 2/3. Chronic diseases used to be seen as a rich man's problem. Not anymore. Unhealthy lifestyles are going global. 85% of people who die from non-communicable diseases are in the developing world. In developed countries, measures of early detection that prolong life are common. Not so in developing countries, where health systems are generally weak and geared to infectious diseases. We cannot allow chronic diseases to even further amplify the health challenges faced by developing countries, especially when we know the solutions.
The reason I'm saying this is because the statistics is, overwhelming. NCD, non-communicable diseases, trump all deaths from communicable disease as well as injury. And I'm happy that, this issue is taking the limelight it deserves.
And the statistics you have just quoted is really awesome. Awesome in a bad way. 36 million people in the world die of these diseases. And if I tell you, 14 million out of those 36 are what we call death before the age of 70. We call this premature death. And they are preventable, totally preventable. Because, it's interesting. The World Economic Forum and Harvard University did a study. In the next 20 years, if we don't take any action, the loss in productivity to the world is about $30 trillion. Now, I don't know how many zeros is in a trillion, certainly many. So $30 trillion. So what does that mean when the world's countries are talking about sustainable development? So we really need to factor that in.
Dr. Chan, I want to start with you. From your perspective at WHO, how are you changing the ways in which you engage governments, particularly in the developing world, on questions around non-communicable diseases, while so many are also still struggling with existential questions of HIV/AIDS, malaria, and communicable diseases more broadly?
More and more we are seeing more people in both developed as well as developing countries are being, affected by what we call non-communicable diseases. Now, these are chronic long-term care. The health systems in many developing countries do not have the human resource capacity, healthcare worker, that know how to deal with it. And they don't have the right kind of medicines or interventions for prevention, for early diagnosis, for treatment. So truly, this is a very important issue. So, the big message for all of us is, how can we start and focus more on prevention across the board? It's not just prevention by the health sector, but we need to work with other sectors to make sure that each and every one can contribute to the whole scheme of things about preventing disease and preventing suffering. And more importantly, if we do not address this, the costs, not only of care, health care, it is not affordable.
This can be labeled chronic or non-communicable. For the purposes of global focus, at this time, we are dealing with 4. They are becoming more prevalent at this time because of our changes in lifestyles, because of the change in environmental conditions. They are killing more people at an earlier age. Countries are spending and will have to be spending considerably more of their budget to deal with these problems. The tendency has been to think of them as diseases of older persons in developed countries. Myth, not true. They are diseases that affect the young, increasingly at a younger age, and they're diseases of all countries.
The economic burden affects every layer of society: individuals, families, communities, health systems, and entire countries, as catastrophic costs hit home. Healthcare costs for people and the rising cost to healthcare systems is already having a devastating impact. And at a global level, progress on poverty reduction and towards meeting the Millennium Development Goals will be threatened. This is a global epidemic that touches everyone, everywhere. Men and women, young and old, rich and poor, all are at risk. Such implications include loss of breadwinners for families, reduced productivity, and poverty. But it's not all bad news. Many of the risks and consequences of non-communicable diseases are preventable. Solutions do exist. Things can and are being done.
There are preventable and cost-effective solutions that are affordable to all countries. Measures to reduce tobacco use and the harmful use of alcohol, reducing salt content in the foods people eat to reduce high blood pressure, and the treatment of cardiovascular diseases and diabetes. These are examples of best buys in public health terms.
We're not starting from square one.
The core question that we're really trying to answer: should the public and private sectors work together to combat diabetes, cancer, heart and lung disease?
The industry must continue to support innovation to make sure that we improve the cost-effectiveness of treatment and to focus our capabilities on preventive capabilities in issues that face chronic diseases. So that's very important for us as an industry to be able to do that. Just as important as that, it's important to think about the collaboration and the cooperation that needs to take place within our industry for international partnerships on innovation, to be able to bring the healthcare intellectual capabilities together, to bring information technology into the picture as well, and obviously then to bring all of these partnerships together. So it goes beyond just medicines and vaccines. It's a stronger, more powerful definition of what healthcare improvement is for chronic disease.
Huge challenge that we face in public health is that we allow the urgent to crowd out the important. And when we think about the problems that we have talked about today, and there have been some great ones, we've also seen some great solutions. When you step back and you think about it, what is sexy in public health? Infectious disease. Infectious disease is sexy in public health. What's boring in public health? Behavioral prevention. So what do? Behavioral prevention. What is this panel about? Behavioral prevention. And when we also consider both within high-income, middle-income, low-income countries, at least 40% of the deaths that happen are associated with what we might call lifestyle factors. Smoking, physical activity, diet, weight management, alcohol use, drug use. This is what is killing the world. And so what I would say, and again, I will be the first to admit that I hate when we pose disease against disease, but what I would say is I think we're at a crucial juncture where it is important for us to not let the sexy crowd out the important. And the important is finding ways to intervene with non-communicable diseases.
Us away from this old dichotomy that you have the problems of poor people, mostly communicable diseases, and the problems of rich people, mostly the non-communicable. And we're understanding that in the developing world, there is now a double burden of disease that's fully entrenched. There's still an unfinished agenda, but there's these emerging issues that are rapidly becoming not just a public health crisis, but indeed a development, an economic development crisis. And I would even pose a security crisis in the sense that they create very serious problems of injustice around the world. We still need to deal with 4 fundamental myths that are out there around the challenge of chronic non-communicable diseases. The first myth is that this is not an important problem for developing countries, because there's still the overwhelming burden of infectious diseases. The second is, well, even if it's important, these countries don't have the infrastructure to deal with them. It's much too complex. The third is, well, even if there are things we could do, it's too costly. We just can't afford it. And the fourth myth is, if we do this, it's going to take away from other priorities.
The complexity with prevention is that we know this unique, we call it a healthcare paradox, that healthcare is overconsumed, wellness is underconsumed. And when you go through the logic, it's quite simple. With healthcare, typically, certainly in developed countries, the price of healthcare at the point of care is usually zero. It's either covered by health insurance or by a national health system, but the benefits are immediate, and people feel that. Whereas with wellness, the price is immediate. You've got to go for that run you don't want to go for. You've got to stop eating the foods that you'd like to eat, and the benefits are 20 years down the line. So the kind of individuals, what health economists call hyperbolic discounting, they value the present, not the future, and they just avoid doing wellness activities. So changing that dynamic is fundamental. A fundamental issue with prevention, what makes it very exciting is that largely it's about behavior change. It's not about the complexity of healthcare and complicated healthcare interventions. If we get behavior change correct, then preventable illness is not eradicated, but certainly delayed. I like the Oxford Health Alliance 3-4-50 idea. 3 behavior types. Smoking, poor nutrition, poor physical activity lead to 4 conditions: cancer, lung disease, heart disease, diabetes, that drive 50% of mortality. So if you can change that dynamic of those 3 behavior types, the effect on the healthcare system, the effect on people's lives, the effect on society, I think is remarkable.
I think we're still struggling with how to acknowledge that in many ways we are blessed with the ability to make miracles in our healthcare system, but at the same time it falls short because we often stay focused on just what happens within the hospital walls or the clinic walls or a doctor's office. And so often, in order for people to really get healthy, we've got to focus on more than just the illness and get outside of the hospital.
Success requires public-private partnerships. It requires a political vision and resource mobilization across sectors, across ministries, and across borders. We also need businesses to be there in full force, and not just the health ministry and health industries. Certainly, we want to work more closely with the pharmaceutical companies to make medicines more affordable and accessible. Let me say, the well-being of your workforces, your very productivity and reputation are all at stake in working for global public health. Millennium Development Goals ushered in unprecedented cooperation and progress on infectious diseases.
This year, for the first time ever, global attention is focused on non-communicable diseases. In September, the United Nations will spend 2 days debating what can be done to improve prevention and control of NCDs.
The summit in September in New York is our chance to broker an international commitment that puts non-communicable diseases high on the development agenda. As Director General of the WHO has said, is taking this issue very seriously. I understand that this is going to be the only second major high-level meeting convened by the United Nations General Assembly only about a decade ago, the AIDS conference. This is a very unique, unprecedented initiative by the United Nations.
And now I give the floor to the Honorable Michael Bloomberg, Mayor of the City of New York, the United States of America.
Thank you, Mr. President. Excellencies, distinguished guests, thank you all. Good afternoon to everyone. For those of you who have come to our city for this meeting and for the upcoming session of the United Nations General Assembly, welcome to New York. We are always delighted to be your hosts, and I'm honored to have this opportunity to address you. Public health remains an intense focus of my philanthropic work as well as my public service as mayor of the city of New York. And without a doubt, the greatest public health challenges in the world today are those that you've identified, the dangers of chronic non-communicable diseases. The increase in cardiovascular disease, cancers, diabetes, and chronic respiratory diseases has, as the World Health Organization warns, has reached epidemic levels. We have made reducing non-communicable diseases the focus of public health policy here in New York City, a city of about 8.4 million people. And I'm happy to report that we have had considerable success as a result. It's fundamental to why, for New Yorkers today, life expectancy has increased faster and remains higher than for Americans overall. Between 2001 and 2008, life expectancy in our city grew by more than a year and a half, and that's an outcome we take pride in and that we worked hard to achieve. And I believe all nations worldwide can achieve similar success. Such results can be and must be replicated worldwide. Because when it comes to preventing tobacco-related illnesses and death, we are in a race with time, a race we can't afford to lose. Here is what is at stake. By the end of the decade, the WHO expects 7.5 million tobacco-related deaths worldwide every single year. Some 80% of those deaths will take place in the world's low and middle-income nations, nations where tobacco companies have stepped up their marketing briskly. As The Economist put it, the tobacco industry is getting the world's poor hooked before governments can respond. Unless we do respond, the results will be 1 billion premature deaths worldwide during the 21st century. That would be a calamity of the first magnitude. And that's why I've also made tobacco control a major priority of Bloomberg Philanthropies. Since 2006, we've established partnerships with governments and citizens groups around the world to implement public policies designed to defeat the global tobacco epidemic. And these policies are familiar to many of you. They carry out the intent of the historic Framework Convention on Tobacco Control, the world's first public health treaty ratified by some 170 nations, and many nations are now taking action. For example, 2 years ago, the Brazilian state of Sao Paulo mandated comprehensive smoking-free public places. Since then, 6 more Brazilian states have followed. Turkey has adopted similar policies nationwide and also mandated graphic cigarette pack warnings and raised tobacco taxes. And so far this year, Nepal, Lebanon, Argentina, and Ecuador and other nations have enacted comprehensive tobacco control laws. The problems of modern life are deeply interrelated, and so thankfully are their solutions. Healthy solutions are not necessarily costly solutions. Far from it. New York's Smoke-Free Air Act, our restrictions on trans fats, and other requirements concerning calorie postings in restaurants cost virtually nothing in public funds to implement. And raising cigarette taxes raises public revenues. Third, collaboration with the private sector and with non-government organizations are very important. Collaboration across borders among national and local governments and agencies is also critical. The challenges before us are too vast and complex for individual governments to overcome alone. But fourth and finally, while government action is not sufficient alone, it is nevertheless absolutely essential. There are powers only governments can exercise, policies only governments can mandate and enforce, and results only governments can achieve. To halt the worldwide epidemic of non-communicable diseases, governments at all levels must make healthy solutions the default social option. That is, ultimately, government's highest duty. And one of the spiritual founders of the United Nations, America's Franklin Delano Roosevelt, once put it, the state's paramount concern should be the health of its people. So why don't we all resolve to renew our efforts now to address the worldwide crisis of non-communicable diseases and bring better health and greater hope to all the people of our good earth. Thank you, and enjoy your stay in New York.
Yes, in fact, 194 countries in WHO a couple years ago, with the help of many partners, including civil society, business, foundations, really raised the political awareness and political commitment, culminating in having a UN declaration on the world's response to non-communicable diseases. Now, having a resolution is important. Having political commitment is important. How do you translate commitment into action? That is a critical step. Now, the World Health Organization, working with our countries, have developed a global action plan on NCD between 2013 to 2030.
Already we have the vision and the tools to prevent NCDs and reduce the risk factors. This WHO action plan offers 6 objectives to plot a way forward. Key objectives of the action plan are to raise the global and national priority of NCDs, promote all of government involvement, and ensure action against these diseases features on the development agenda. To be successful, the plan will need commitment at all levels of society and from all sectors. First, though, it will need leadership from government.
Now, what does that mean? What does it take? So the countries themselves must first and foremost have a national plan and identify what are the diseases that are causing big problem in their country, and then develop a plan and then introduce affordable, quality interventions to prevent illness, and at the same time, those people that are already having illness, you need to provide the early diagnosis, early treatment. If indeed some people unfortunately have cancer or stroke, rehabilitative service is extremely important.
The world must act now to control the growing epidemic of non-communicable diseases, as more and more people are affected at an ever younger age.
What is sad is that these chronic diseases kill many young people who will be the next generation leaders, who will be a productive generation, and therefore we must do more.
At stake is more than the hard-won gains made in developing countries and poverty reduction initiatives like the Millennium Development Goals. At stake are the lives of millions of people around the world who will otherwise suffer needlessly and die prematurely for lack of concerted, coordinated action.
say, what's a cell phone company doing on a chronic disease panel?
What mHealth is about is 5.3 billion connections to people, going up really fast.
So mobile health is a catalog of things.
A form of personalized medicine or personalized health.
What mobile health does is it takes the right information and access to service providers and puts it right in the patient's pocket.
And it's how you use technology to deliver an intervention to a patient. So in other words, is how you can change the paradigm to have a patient-centered approach.
Health happens when you're on the move, whether you're a physician, a clinician, or a consumer patient.
People are mobile, and wireless brings mobility. So it's not about the mobility, it's about the connectivity.
I mean, you can do anything along the healthcare spectrum, from really complex, telemedicine, telehealth, teleradiology, to basic services, getting an SMS about sexual health and reproductive services.
Health content on SMS, health content on mobile web, even original health videos.
Mobile health to me means meeting people where they are, not just geographically, but also emotionally.
mHealth is really a platform. It's in your hands, it's in your pocket, it goes with you wherever you are, and it's a new way to reach the last mile.
Improving access dramatically to health services. So leveraging the phone in a pocket, in somebody's pocket, we can extend health services in a way that we couldn't before.
mHealth, disruptive, low cost, it's all about the potential.
It has luckily become an inclusive technology which has crossed all classes and all barriers and has reached even the poorest of communities.
So mobile health is always on the go healthcare.
Doing anything related to your health on your cell phone. So whether you're doing a personal health record, whether you're checking your glucose level, or whether you just want to know how far you walked.
Mobile health is something which is more of a revolution.
There's going to be a convergence between mHealth and eHealth.
eHealth, mHealth, whatever you call it, because I think the greatest need is in the rural populations of Africa, and that's where I want to make a difference.
With mobile health, they can actually be diagnosed, on a remote basis. And I just think it's a great tool because it can provide access.
And I think that providers need to learn that they need to get in there and be willing to interact in ways that are uncomfortable and ways that are just not what we're traditionally used to doing. And I'm hoping that we'll rise to that challenge.
The challenges of dealing with a patient with HIV/AIDS, where you need to have a person on therapy for the rest of his or her life, the questions of compliance, the possibility of innovative uses, first of all, of the drug delivery itself. I mean, we've made enormous progress in packaging drugs in a way that makes compliance better, and then using mobile technology for those purposes. Those lessons are applicable for diabetes care, where you have a similar situation, or for many cases of cancer care.
We're seeing today people having access to communication tools that were beyond the reach of the public health system for the past 3, 4, 5 decades.
Behavior happens in real time. And the way that we look at behavior right now is in these snapshots that are sort of encapsulated in like a survey or whatever, but that's not how behavior works.
Mobile technology can really provide so much data
that can then improve people's behavior.
With the prevalence of non-communicable diseases matched with the increased growth rates of mobile penetration in areas where the need is greatest, creates a huge opportunity to affect change.
Wellness technologies have huge potential, and most of this potential is untapped. So now we have the possibility to know what people are doing and to intervene or give them the information they need at the moment that's going to help them the most. It can become an extender of existing treatments. So it may be that a person goes and sees a doctor and then would also be receiving an mHealth intervention.
There's huge opportunities for empowering patients and empowering communities and helping in training healthcare workers as well.
There is an opportunity of bringing the governments on board to apply mobile health solutions that will drive a dramatic and systemic change in the public health pathways.
And wellness provides two distinct opportunities. Optimize current interventions that we know well, get better information, real-time information, more relevant data to the people who are doing great work in the field, and to make those interventions that are working well work faster and harder and at greater scale.
There are inherent qualities of mobile tools that we're in the business now of assessing and evaluating which ones make the most sense for ministries of health and governments to invest in.
Interesting thing is, countries across the board, developing, they have still room to improve. But by and large, I think developed countries have done better than developing countries in terms of, tobacco control, healthy lifestyle, and also more exercise, promoting exercise. So there is a time lag for developing countries to catch up. It's not to mean that they don't know what is the issue. Is that, the government need to provide the enabling environment for ministries of health to work with others to keep people healthy. To have a comprehensive package from promoting good health, preventing disease, treatment, of course, including early diagnosis and rehabilitation. So WHO is working with many partners.
We need to move from the idea of health policy in the strict sectorial sense to healthy policies that involve all instruments of public policy to promote health.
Now the society has changed. Social media, ICT, the power of ICT, etc., etc. Here today we are in, of course, the UN General Assembly. One very important issue we are talking about is the importance to fill the data gap, invest in collecting good data, doing good analysis, and then to document progress or lack of progress, and hold government and other actors hold their feet to the fire. Because it's easy for people to stand up and make commitments, whether or not they walk their talk. The job of civil society and academics is to make sure that, we don't walk away from our commitment.
But I agree. I mean, this is one area that illustrates the need for a whole new generation of preventive approaches that think about health not as a specialized sector of public administration, but as a social objective that requires the engagement of all areas of public policy, of industry, and very importantly, of civil society. You know, we've been divided in the public health arena between vertical programs that focus on specific diseases and horizontal that strengthen health systems but without any clear sense of priorities. I really think we need to find a diagonal approach in which we use a number of specific priorities to drive the general improvements and build the capacity so that when we are successful, as the Secretary General was saying, we have left behind the capacity to deal with the next challenge.
But I like to pick up on the point you talk about body mass index, BMI. The BMI that is applicable for, Western world may not be applicable to the Asian society. We notice that in many Asian population, including China, India, and we just heard about the diabetes situation in India, you don't need to be very obese, and you can get into problem with pre-diabetic conditions or diabetes. So depends on, where are the data sources for the body mass index. So what is useful, applicable in the States may not be applicable for the country. What I'm saying is that you do need country-specific data in order to help people to say, okay, is this a good measure for me to pay attention to?
It's exactly the sort of capacity. We need to build a new generation of health professionals that are better trained to deal with this set of challenges. I mean, to me, we need that kind of capacity, and I expect that if we do that right, a lot of the innovations we're talking about are going to actually first emerge in developing countries, like what you were talking about, in the use of mHealth. And we may even be, in less constrained settings, setting examples that can then bring some important lessons to rich countries in how to handle some of this technology. Because we're not going to be able to deal with this tsunami of non-communicable diseases by following the same path that currently developed countries followed. We need to innovate in the delivery, innovate in forms of coverage, and have a comprehensive view towards disease prevention and health promotion. And we may generate innovations that can be valuable in feeding back to the rich countries.
I think it's a question.
The World Health Organization and the International Telecommunications Union have teamed up to champion the use of mobile phones to help people live healthier lives. Our toolkits provide a package of proven solutions for countries to implement, like promoting a healthy diet and general wellness, smoking cessation, and diabetes management.
WHO is bringing the world's best health experts together with governments and policymakers to help them activate the Be Healthy, Be Mobile initiative in their countries.
It enables also to create partnership. Those two elements coming together and bringing public and private partners together, not only United Nations organizations and private sector, but also non-governmental organizations and the consumers themselves.
I'd argue this is the most exciting time in healthcare since we discovered penicillin.
Be Healthy, Be Mobile is focusing initially in 8 countries. We are ensuring that ministries of health and telecommunications, academics, NGOs, and the private sector are working together.
Because you've got a combination of factors. It's the ubiquity of the mobile device. It's an understanding that real-time data can give you information that can radically change outcomes. It's the falling cost of sensors, of processing power.
It's very exciting because it has reach at national level with rollout to national governments. It's tackling one of the very biggest issues of the moment, which is non-communicable diseases, and it's using the platform of mobile technology to its fullest extent.
We at the International Telecommunication Union are very proud of our partnership with the World Health Organization. We are working together on a unique project to make peoples of the world happier, healthier, and living longer.
La experiencia que nos está dejando de
Our experience has been a good one. It's a low-cost but highly effective system.
Sistema de bajo costo, altamente efectivo.
Deja de fumar y salí a ganar.
To spread the word about the program, the government has launched an advertising campaign featuring some of Costa Rica's best-known football stars.
We don't want to be just one more project. We want to have a sustainable mHealth plan. In Senegal, we have big health priorities and we don't have enough resources.
Trying to find ways to develop a generic platform that can be easily moved to another country at very low cost.
43 million children, preschool children, are obese, and they have a strong link to diabetes. Please make sure we need to work with the education sector to reduce that tsunami of obesity.
Well, roughly 1 in 3 children are overweight or obese in the UK, and that's mainly due to our obesogenic environment where portion sizes are bigger, high energy dense foods are more readily available, and we're just not doing as much physical activity as we used to.
A year ago I used to be all bloated. I felt like just sitting around and doing nothing the rest of my life. My name is Karim Dursi. I'm 12 years old. I live in Wembley, London. In school I used to sit in the back so no one can notice me. In football I always used to be the last one getting picked. I felt ashamed. It made me feel bad. It made me feel like I'm the only person in the world. I usually take bus home, and when I get off I usually go through fast food shops like KFC, Sam's, McDonald's. They're all over the place, and after school it's usually half price, buy one get one free. They target young people. They have like mascots that go to you. They're usually standing outside. They say, come, we have the best food. It's low in calories even though it's a lie. It's hard to resist is because, you know, everyone likes junk food is because it's sweet, it's unhealthy. At the end of the day, you're just gaining weight for yourself.
Dear colleagues, I'm sorry that I can't be with you in person today, but I'm delighted to have an opportunity to add my voice to yours in support of mHealth and the Be Healthy, Be Mobile initiative. At Public Health England, we think mobile and digital health could transform the field of public health, and we want to play our part in promoting it so it can deliver its full potential.
If I had to ask governments to do one thing, it would be to address the issue of tobacco seriously.
The developed world has seen only one side of tobacco, which is the smoking forms of tobacco, and that too only cigarettes. Whereas India has myriad varieties of tobacco, and that includes smokeless as well as smoking forms. And in smokeless, the products are so very cheap, which makes the availability and affordability for the young people to experiment at a very young age and to be able to continue even if they are from a very low socioeconomic condition.
मेरा नाम आराधना है, मैं 15 साल की हूँ। मैं नई दिल्ली खिचड़ीपुर 6 ब्लॉक में रहती हूँ। मेरे घर का पता 6/135। हम एक बार हमारे पापा जी बैठे थे और हमारे पापा जी स्मोकिंग कर रहे थे। हमने अपने पापा जी से बोला, पापा जी आप ये क्या कर रहे हो? तो पापा जी ने कहा, मैं दिखता नहीं, मैं बीड़ी पी रहा हूँ। मेरे पापा जी मत पियो, ये बहुत ख़राब चीज़ है। पापा जी को हमने समझाया कि पापा इससे गैंग्रीन गले का कैंसर और हमें आप ही को नहीं हमें भी नुकसान हो रहा है, कि आप चाहते हो कि हमारे साथ भी ऐसा हो? तो पापा जी ने उसी दिन से छोड़ दिया। पैसों की भी बर्बादी होती है, काफ़ी चीज़ों आपको ही नहीं, पैसों की भी बर्बादी होती है कि हम उस पैसे से हम पढ़ नहीं सकते, पढ़ेंगे और भी हमारा ऊंचा नाम होगा और भी काफ़ी चीज़ों में शायद अच्छी चीज़ होगी तो हमें भी पीना चाहिए। फ्रेंड्स भी पीती हैं तो वो भी एक आध बार बोलते हैं कि पी कर देख कितना मज़ा आता, तो उससे भी हमें भी थोड़ा अच्छा लगता है कि हम भी एक बार पी कर देखते हैं। 10 में से 7 या 8 लोग इन चीज़ों का सेवन करते होंगे। 7 या 8 लोग मेरी उम्र के तंबाकू, बीड़ी, सिगरेट का सेवन करते होंगे।
Governments do 3 things: taxation, legislation, and regulation. And in that context, these are the things that we're asking governments to do now. We're asking governments to adopt what we call a whole-of-government approach, and not only the health sector, but other sectors in government to be involved.
But these diseases are about more than individual health. They also pose enormous economic and development challenges, damage productivity, and drive people into poverty. Dr. Jyoti Dev is a diabetes specialist in Kerala, southern India. He's already seeing the economic impact of non-communicable diseases on the people he treats.
The average income of a person is less than $2,000 per year. With the development of multiple complications of diabetes, the average cost of treating all these complications will be more than $3,500 per year. Incredible. How can they treat this disease?
And why am I so passionate? For those of us who are coming from Asia, we know that diabetes is having a home run in India, in China. For some strange reason, we need to do more research. Asians, including Chinese, Indian, and for putting on less weight, we have a higher probability of getting diabetes. And when we get diabetes, we die much earlier than Caucasians and Europeans. This is also an inequity, isn't it?
Health systems, mobile phones have a large role, particularly in India, and you could use mobile phones for targeted screening of patients who come to primary healthcare centers or hospitals. We can use mobile phones which are embedded with a decision support system which can guide frontline health workers in imparting lifestyle advice to patients, in actually easing the workflow in primary healthcare centers, in providing reminders and alerts to patients as well as healthcare providers in getting back patients for follow-up, in providing advice to doctors in the right kind of treatment. So there are several roles where a mobile phone can be used.
In fact, it's already happening. For example, we've got evidence that SMS texts are an effective way to help people quit smoking. We've also got evidence that sending SMS reminders for screening appointments can help increase attendance. Now, I've used these two examples because they're a reflection of two fundamental ways in which mobile is revolutionizing public health. First, because of how mobile can empower us to lead healthier lifestyles in ways we've never had before. And this isn't just hype. There's been an explosion in mobile health apps, 97,000 across app stores worldwide. The second aspect of this revolution is how mobile health can support health systems. It will do this by making it easier for healthcare professionals to deliver services and treatments in ways that are effective, low cost, and convenient for the patient. And mobile health could allow us to scale up and sustain prevention efforts across entire countries. Now, at Public Health England, we're absolutely committed to grasping the digital opportunity and pushing ourselves to see how much further we can go with it. Now, we'll get further and we'll get faster if we learn together. So I'm excited that the Be Healthy and Be Mobile initiative has managed to bring together so many key partners. We are really proud to be a part of this collaboration.
US FDA, yes, they approved 12 cancer medicines. And out of those 12 cancer medicines, 11 of them cost more than $100,000 per person per year for treatment. How many countries can afford that? So go back to the most important messages, which is embraced by all countries in WHO. We have 194. I don't know how many bosses you have. I have 194 of them. And they all embrace, prevention is the cornerstone as a global response to NCD.
Is using wireless technology as a key enabler and focused in on healthcare as an opportunity. And the reason is because the wireless communications can provide a real-time link and can actually close the loop. And we like to joke a little bit that, take 2 pills and call me in the morning. That's a slower feedback loop than you can get from a device that you have with you all the time. In the developing world, it's a completely different issue. And there, what's so interesting is that it's the wireless operators who have a very good day-to-day relationship with people in those countries. They're seen as very trustworthy, and they have a lot of assets to bear. They have people out in the field, they have call centers, and so what's happening now is that you can imagine that you'll have a lower skilled person go out into the field and do data collection and transmit that information back to a call center where there might be a nurse, a more skilled one, a doctor, and so forth. So you can imagine the productivity gains you can get and also the ability to scale and get that out there. And because the number of devices out there in the market right now. So you think about that from a platform to scale education, and then if you can actually hook those up to other devices that might monitor your health, I mean, the numbers could be quite large.
The actuarial data is very compelling. When people engage in these activities, healthcare costs go down, mortality rates tend to go down. And all of these studies about companies doing the right thing in terms of wellness, it seems to be one directional. I would say to you that we're at the embryonic stage of understanding the power of prevention. We're just scratching the surface, and I think one of the things we have to do, and we're certainly investing in that, is understanding the data, understanding the causality, and coming out with best practice to make sure that we do change society in the right way.
if you rank them, leaders don't like to be at the bottom of the league table. I mean, it provides them with the political energy really to take action. So data is important, measurement is important, what gets measured gets done, and that provides the framework for transparency and accountability. We are beginning to see CEOs of companies who understand the importance of share value and are really moving ahead. I asked them the question, why? Is that you can do good and make profit at the same time, because more and more countries, their people are so sophisticated and well educated. If you don't do it, you are behind the curve. You would be left behind.
I think one of the ways that foundations and other NGOs can get involved is to provide new information that can reframe some of these thorny issues. One of the studies that comes to mind is one from last year where the Hudson Institute, working with Hank Cardello, really asked the question, do companies that have, food and beverage companies that have more better-for-you products in their portfolio do better? Can you do well and do good at the same time? And just to cut to the chase, when they looked across 15 or so companies with different amounts of better-for-you products in their portfolios, those that had more better-for-you products, as they defined them, actually had a better operating profit, enjoyed better reputations, and delivered higher value for their shareholders. So funding those kinds of studies and reframing the debate, if you will, and showing the ways in which business can build a healthier environment by doing what they do, which is providing products, it reframes the debate and creates an opportunity for us all to work together towards better prevention and healthier lifestyles.
We surveyed 8,500 of them that what they want is support in their daily lives 24 hours a day, and they want help basically to prevent diseases. We can most effectively deliver that through mobile devices because essentially they can have health support in their pocket. It's amazing. I think also this particular partnership with WHO and ITU gives us an opportunity essentially to work with people we wouldn't normally work with, to get to places we wouldn't normally get to at a national level, and then to really scale up so that for our technologies and services that we already have, we've now got a chance to try them out on an almost unforeseen level. So it's very exciting, and I think for us, we're really beginning to see that this is a disruptive technology. It's allowing us to deliver healthcare, and I think we've really got a chance to do it because it's something that supports us in our everyday lives, which is where the generation of chronic disease begins.
The provision of healthcare through the use of mobile devices, or mHealth, is becoming a global reality. The lower costs, immediacy, and widespread availability of mobile technology are changing the way patients receive their care, making healthcare faster, better, and cheaper. According to PwC commissioned research by the Economist Intelligence Unit, the general perception in the marketplace is that mHealth will have a significant impact on the delivery of healthcare and bring about fundamental changes to the way the industry provides healthcare and does business. mHealth is already having an impact throughout the world and at different rates of adoption, with emerging markets moving faster than developed markets. And yet, significant barriers to adoption must be overcome. Businesses will need to develop patient-centric business models that focus on optimized clinical outcomes, value for money, and patient satisfaction. They will need to create solutions which are fully integrated and operable as part of a new healthcare ecosystem. In this changing industry climate, the differentiation between a healthcare strategy and a mobile healthcare strategy will be dissolved. Mobile healthcare strategy is critical.
There are a number of challenges that we face moving forward in this space.
One of the biggest challenges is not to be carried away by the technology for its own sake.
As soon as we think we have something and we start to evaluate it, the technology is old, the approach is dated.
Consistency of platforms. Bringing the governments on board. They need to put money on the table and resources and leadership to make it happen.
How do we provide individualized information that makes sense to such diverse and independent populations?
One of the challenges I see is that everybody talks about challenges and obstacles instead of talking about assets.
We don't have to have the very latest version or iteration of a technology. We need to design for the user.
How to effectively use mHealth interventions to interact with low literacy populations.
We don't quite yet know what the true potential of these technologies are.
There are a lot of different types of challenges with implementing mobile technologies in healthcare. I think one of the biggest challenges is how we think about the use of technology. If we think about how the technology fits into people's lives, how it might be able to create new opportunities for us to have those conversations, to intervene, to help support what their goals are, whether they be health and wellness or whether they be better management of their conditions. Then maybe we'll start to develop solutions that will really kind of answer problems for people and thereby kind of be more rapidly adopted within the system.
Fortunately, in the last few years, we saw a lot of innovations coming into the market in terms of new ways of doing things, providing tools to empower the end user to take care more of their own health. And we see those types of innovation are great because the health system obviously cannot deal and cannot interact with the patients all the time, particularly for chronic disease situations. So, however, what we see in terms of the key problem is how to get those innovations to reach the right level of scale. And obviously there are a lot of barriers that we are trying to work together with the government, with all the stakeholders to kind of overcome those barriers. And one of the most important things is how those innovations be integrated within the health system and not to be always seen as a kind of an ad hoc or kind of left alone and isolated types of intervention.
There has to be research behind the technology that's coming out, and there has to be a partnership in that. Otherwise, the myth and the hype in mobile health is going to overtake all the beautiful things that we can do with it.
To make sure that the enthusiasm that everybody has here can be used in the reality and in the field at country level.
Traditionally, we tend to think of like, I'm a diet person, I'm a smoking cessation person. There are commonalities across all of the health behaviors that we're trying to intercede in.
We often talk in global health about the need to partner with the private sector, to engage with governments and academia and civil society. But in practice, it doesn't happen very often. And this workshop really gave us the opportunity to provide a forum where all the different partners could come together and really share common objectives. And although our rationales and the initial reasons for our engagement may differ, we all have very similar goals when it comes to wellness.
There is a massive possibility here, and so that's why I believe all this expertise is being gathered.
I see a lot of partnerships evolving. I see possible research coming out of this.
The need to be agile and consistently looking at the future and at innovation. And it's something that in academia we're not necessarily so good at, and at the governmental level we're also not so good at. And it's something that the private sector has excelled in. What are
We are very proud to have joined this initiative because of mainly two things. First of all, this is a very focused partnership. It's going to target one of the key elements of NCD care, which is prevention, but it's also a very cutting-edge exercise.
Zambia joined this initiative because of the great opportunities that it presents to us as a member state. We have high penetration of mobile phones. Our population usually communicates by oral traditions, and this was a very cost-effective way that can reach a lot of people at a short time and in a very cost-effective way.
We're very excited about this program because this is an excellent opportunity through mobile phones to give the whole Costa Rican population an opportunity to be able to stop smoking.
Two facts determine the modernity as a golden era for mHealth. First is the number of mobile subscriptions, up to 7 billion, which is 96% of the population. And the first fact is that cell phones, smartphones and PDAs became the most personal devices we ever had. Most of us keep the cell phone most of the time not farther than a half a meter of us. Russia is excited with the mHealth perspectives and welcomes Be Healthy Be Mobile initiative by WHO and ITU.
The Be Healthy Be Mobile initiative is also particularly interesting because 3 years after the adoption of the political declaration in 2011, we're now really moving into an era of action rather than just political commitment. And so this WHO-ITU initiative obviously has a global reach, but it's also very much at the national level through governments in terms of implementing these mHealth initiatives, whether it be prevention, treatment or enforcement. But it's really kind of showing the world that governments and the UN organisations, along with other partners, are taking action on NCDs.
The Global and Wellness Workshop aims to encourage collaboration between the partners participating to prevent and control non-communicable diseases through the use of wellness and mobile technology. And that's a fantastic possibility. The thought that working together we can make a huge difference to millions of lives controlling their NCD conditions.
We are really proud to be working in partnership with the WHO and ITU. Bupa's purpose is longer, healthier, happier lives, and working on the Be Healthy, Be Mobile initiative in partnership with them, I think we'll be able to make a much, much bigger difference to the world's health.
Health services to be sustainable, and in order to reach millions more people, we have to embrace mobile solutions as part of the ecosystem of health. We understand in Bupa the burden of hypertension specifically, and what we know is we can't tackle it on our own, and we need to be working with some of the leading thinkers in order to find ways of tackling hypertension and other non-communicable diseases.
So the event is part of the WHO-ITU joint initiative that's called Be Healthy, Be Mobile. The initiative is meant to identify technology-driven and mHealth-driven solutions to curb the burden of non-communicable diseases. And the way to do that is to bring experts in a room from all kinds of industries, public health sectors, ministries of health, which was what we've done today, to help us identify what are gaps in addressing non-communicable diseases at a national level and how we can supplement these efforts with the use of mobile technology.
I think this sort of work and the technology that comes with it could do a whole lot in the messaging, in the actual moving people down that behavioral change line. But also, in what we are challenging the group in this meeting, is to even go beyond that, because the evidence that we have seen that unless the infrastructure, the leadership, the supporting environment is in place, unless we work on the supply side of things as well, then trying to create a demand for something that we cannot really provide is going to be a tricky thing.
It is a combination of factors, and it is very much kind of bringing together technology, business, and human behavior, and understanding human behavior, understanding human beings, their aspirations, their needs, what they believe in, their fears, their hopes is really key from our point of view. And it's in many ways a way to make business and technology intelligible to, at the end, people that are going to adopt it. So when it comes to hypertension, for example, this is a behavior level problem. It's a lifestyle problem. So even if you decide to kind of use technology to try and address it, you better understand first how people behave, how people think, and how to embed these interventions into their lives to be effective.
So we're really hoping to come out of this workshop is to get a really deep understanding of how we might be able to use mobile technologies to implement what we call the best buys for cardiovascular disease prevention and management. And these are interventions that have been really well studied. A lot of supporting evidence for them that's produced by the WHO and often local councils as well. But it's really how do we realise that opportunity for technology to create new moments, new ways of implementing these things, and thinking through what kind of supporting ecosystem has to be in place in order to do this.
Alcohol is a major problem in this country. A study done recently illustrated that 2 out of every 10 young people before the age of 15 have tried, used, or are intending to use alcohol in the next 1 year.
Okay, my name is Daniel Ayila Bola, and I am 23 years old. I stay in Nairobi, Kenya. Yeah, I started drinking at the age of around 14. You want to be the coolest in school, and so I tended to join the group that was cool and that used to drink a lot in school. I was suspended from school almost 1 million times because of my drinking. And also it affected my studies a lot. My final grades in high school were not so good. Actually, they were not good at all.
Here we are in Korogocho. This is a village, the second slum in Kenya in terms of size. Even there are some people who don't even go to work. They engage in drinking from morning till evening, and you find that quite a number of families have even broken because of this kind of drinking.
You know, many people, especially in my neighborhood and in my school, we used to compete about who can take the most alcohol.
This is just one of the bases that we have around in Korogocho, and these are the very places that open as early as 5. And by that 5, I mean, you find people streaming in. You find people, young, aged, girls, women.
You know, some of these advertisements that we see on TV bring out the power in you, bring out the best in you. Is some of the things that are attached to alcohol amongst the young people. And so that pressure, the cool feeling and the cool kind of standard that young people give to alcohol is what makes many young people take alcohol. I can't say where I would be right now if I continued drinking, because I was drinking large quantities and by now it would just be a cabbage.
So the result, I think, is that we're going to see mobile health actually roll out more strongly in the developing markets. But I think that in a few years, it will be the case that, you know, as today you feel like you're connected with your friends and family because you have your cell phone with you, not because you're talking to them, but because you could. In the future, you'll feel the same way about your health professional. Not that they're always monitoring you, but they can in case something goes wrong.
Where prevention fails in other sectors, and the health sector becomes the receiving end of failure in all policies. So this is an issue where the health sector alone cannot turn off the tap. We need every sector to work together. Education, trade, as well as, you know, what is the government policies? Do they provide a healthy environment for people to make wise choice and healthy choices?
Other than the tobacco industry, my member states
never tell me not to work with the industry to find public health solutions. No government in this day and age can find all the solutions without public-private partnership.
The United Nations or government as a whole, in general, can make policies, but they cannot do it alone. They need support from business communities, they need support from academia, they need support from NGOs, educational institutions. I think all should work together. It's quite encouraging that we are paying heightened attention on this NCD. We need to make this world better for all, whether one lives in developing or developed world. The healthy society, healthy people makes healthy society and healthy world. Then by doing that, we can make our world sustainable one. Therefore, my urge to you is that let us work together. We will lead you, but I hope that you will always support the work of the United Nations, work of your government.
What everyone's going to be engaged in some level if you're involved in global health in the future.
This is the beginning of something that it is going to happen and it's going to be very big.